Good morning to you. Influenza week is December 7th, today through the 13th. So what better time to understand the mystery of how the flu works and how we might be able to prevent getting it. Please welcome Dr. Clancy from Tri-City Medical Center. Well, we may as well do it, right? We're not sure that that's a proven method, but tell us a little bit about the flu. It really is a mystery to some people, trying to avoid it and not sure how they can get it and how to best treat it if you do.
Well, San Diego had a rough year last year, and I think the flu can be very deadly, especially to our elderly. So it's important to get vaccinated.
You know, you were telling me earlier that it's our underlying medical conditions that really become the problem, not necessarily the flu, but the flu can act like a catalyst to cause other problems to come out that we may already have. Can you talk a little bit about that?
Well, seniors are most at risk because they have immune conditions that reduce their body's response to fighting the flu. People with emphysema, asthma, diabetes, and underlying heart disease are especially at risk. And it's those underlying conditions that come forward when you get sick with the flu that actually cause deaths.
What are some of the best ways we can avoid getting the flu during these critical times?
Well, you want to stay away from close contacts. If someone you suspect in the family has it, make sure you wash your hands. Keep the areas in the house clean. Don't let your kids share utensils or cups, and get the flu shot.
When we were kids, we were taught cover your mouth when you cough, and that meant with your hand. Now people cough into their arm. Is that how we should be teaching our children?
Well, I don't think that's a bad idea. Covering your mouth, turning your head away. You don't want to spread germs that way.
Tell us a little bit about the flu shot itself. I know there's a little bit of mystery and some myths surrounding the shot itself and whether or not it's a live or a dead virus.
Well, the flu shot is a killed vaccine, which means you really can't get the flu from the flu shot. You can still get the flu even though you receive the flu shot. So you just have to use precautions and stay, especially if you have immune conditions that reduce your ability to fight the virus. Put yourself in a situation where you're not exposed to it. So
the shot is not necessarily the cause of the flu for people who have said, I've taken it and then I got it. It's really coincidental?
Yes, it is. It is. The flu shot does not cause the flu.
Now that being said, not everybody should take it. So what's the best thing to do in those cases?
Well, I think if you have certain conditions where you're not sure, you have immune conditions that reduce your ability to fight the flu, or you have medical problems that are complicated, you should check with your primary care physician to see if that flu shot is right for you.
Okay. If people want to reach out to you directly, how would they find you?
They can find me at Tri-City Medical Center.
All right. Well, thank you so much, Dr. Clancy. It's definitely dispelling some of the myths and giving us the best ideas on how we can prevent getting sick. I am going to shake your hand. I'm not sick, so
Thank you.
Thanks for being here with us this morning. All right.